This is Travis Taylor, Healthcare Administrator and Educator for Voyager Home Healthcare, Section 6, General Orientation.
Alright, today we're going to talk about infection control. Voyager Home Healthcare will provide training for its employees regarding the agency's written infection control policies and procedures at the time of hire annually. Voyager shall evaluate the adequacy of its infection control policies and procedures annually, make any necessary changes, and document all changes in writing. Standard precautions. Standard precautions are important because they help promote efficient self-care in a client's home. Work practice controls that promote safe patient care in home are important. Standard precautions are also important because they promote work practice controls that eliminate or minimize employee exposure to various communicable diseases and bloodborne pathogens. And it is important to note that you should use standard precautions when doing all clinical procedures. The first procedure we're going to talk about is hand washing. The hands should always be washed before and after patient contact. Always wash the hands with bar or liquid soap and water immediately, as soon as you remove your gloves. If soap and water are not available, use an antiseptic hand cleanser or towelette. Employees should always wash their hands if they become soiled during patient care. The uniform. All home care staff should keep an extra clean uniform in a water-resistant bag in their car. If a staff member's uniform becomes soiled while performing patient cares, they should change it to a clean uniform as soon as possible. Place the soiled uniform in a leak-proof plastic bag. Gloves. Always wear gloves if there is a possibility of coming into contact with bodily fluids. Always change gloves when going from dirty to clean and between patient care procedures. Sterile non-latex gloves should be worn during certain clinical procedures that require the use of sterile technique. Wear disposable non-latex gloves when performing any procedure that may expose you to the patient's blood or other bodily substances. Sterile and non-sterile non-latex disposable gloves should be disposed of immediately after use in a trash bag that does not leak. Masks. Disposable face masks should be worn in the event that there is a possibility of a droplet transmission. All masks should be thrown away immediately after use. In the event that isolation is required for a client, make sure a warning sign is posted outside his or her door. Warning. A sign stating stop should alert everyone of the need to wear a mask when entering into the sick client's room. Immunizations. It is mandatory that all staff involved in direct patient care receive an initial 2-step tuberculosis skin test. Repeat skin testing will be done annually. It is strongly recommended that all staff who participate in direct patient care be immunized against hepatitis B. In addition, it is recommended that staff be vaccinated against or have documented immunity to mumps, influenza, rubella, and measles. Previous BCG vaccination is not a contraindication for skin testing. Trash bags. Always make sure to follow local, state, and federal ordinances regarding disposal of biohazardous waste. All soiled dressings, disposable gloves should be placed in an impermeable plastic trash bag, then secured. Place the trash bag in the family-owned trash. Sharp objects and needles. A needle should never be sheared, bent or replaced in the sheath or guard, or removed from the syringe after use. It is important to place sharp objects and needles in a puncture-proof disposable container that can be sealed with a lid. Do not recap used needles. Sharp containers. It is important that sharp containers be leak-proof, puncture-proof, be red or opaque in colors, and be labeled or marked with a biohazard sign. It is also important to note that sharps containers should never be filled over 2/3 full. They should always be kept out of reach of children, and that local ordinances are always followed when disposing of sharps containers. And just some miscellaneous information. When there is a reasonable likelihood of occupational exposure to bodily substances, eating, smoking, drinking, applying cosmetics, applying lip balm, etc. should not be done or handled in patient care areas. Food and drinks are not to be kept in patient care areas where blood or other potentially infectious materials are present. Staff should perform all clinical procedures in a way that minimizes spraying, splattering, or generating droplets of bodily substances. Specimen collection. Always wear gloves when handling specimens. Handle all specimens extremely carefully to prevent and minimize spillage. Label specimen with the patient's identifying data. Any bodily substance specimens should be placed in a leak-proof plastic bag and secured in a leak-proof container during handling, collection, transport, and storage. When transporting in vehicles, specimens should always be placed on the floor of the vehicle. OSHA regulations. Infection control standards and policies published by OSHA will be made readily available to all Voyager Home Healthcare staff. A copy of these regulations will be placed in the Infection Control Manual. Voyager Home Healthcare will have an infectious control program that identifies patient risk for infectious organisms upon admission. Exposure. In the event of body contact with the patient's bodily substances, first irrigate the exposed body part with soap and water. If it's the eye, irrigate the eye as soon as possible. Use bottled sterile water stocked in the nursing bag or car as necessary. Secondly, you should contact the Home Health Care Agency Infection Control Director for follow-up instructions and care. In addition, report suspected tuberculosis exposure or any other infectious organisms to the Infection Control Director immediately.